today we're going to cover something really important. Actually, everything we talk about is very important, but this one's near and dear to my heart, and that's cardiovascular risks and why exercise is so imperative in terms of help lowering any of those risks.
Was that pun intended? You said close to your heart?
Oh, there you go. And there was a pun there as well.
Look at that.
I didn't catch that.
That's okay. And with us is Dr. Omar Issa of Coral Gables Cardiology Associates. He is board certified in internal medicine and cardiology. Welcome to Smart Life, Doctor.
Thank you for having me. It's a pleasure.
Thanks for spending some time with us, Doctor, because we know how busy you are. Near and dear to my heart because, you know, I'm that girl that I feel like I've done everything right. You know, I eat well, I do exercise. I'm sure a lot of people can relate to this. And I have high blood pressure, right? So I think I've done everything right. So sometimes that just happens because there's a genetic predisposition, if you will.
Yeah, correct.
All right, and how does that work?
Well, what we call essential hypertension is genetic predisposition towards hypertension. Obviously, it runs down family lines. We don't have a very strong explanation as to why some people have higher blood pressure than other people, but it definitely is something that is a risk factor for future things to come. And if you don't get a handle on blood pressure like that, all sorts of problems that, you know, starting with the heart, obviously, and coronary artery disease, but also the kidneys and a lot of other systems of the body. We
want to talk about exercise and how important it is, but what are other risk factors besides genetic disposition? Age?
Well, age is certainly a risk factor. There's obviously family history of heart attacks at a young age is another one. High cholesterol, a big one.
That's huge.
One of the worst ones is diabetes, I would say. Right. Affects a lot of the systems of the heart. And then some of the things that you can actually control, like smoking and inactivity.
Right.
So many risks.
You know, it's funny that you say that because 9 or 10 out of 10 doctors that we have here, that whenever we talk about whatever ailments they're working on, a lot of the causes, the treatments are always is diet, no smoking, and exercise. Exercise.
It's kind of like the prescription recipe for success.
Yeah, people don't want to hear that. I have to exercise, but
right.
you have to.
Well,
and how does that help? Why is it that exercise can make such a difference in somebody's blood pressure? Can we be specific as to why?
Well, for many reasons. First of all, the actual activity of exercise. If you notice, if you check your blood pressure the night after, you know, a run or some sort of exertion, you notice that it's actually lower at that time because after something like that, your arteries dilate, and so that can bring down the blood pressure a little bit. But it's kind of all tied together with a lot of the other metabolic risk factors. So when you exercise, you have a tendency towards losing weight. When you lose weight, that also brings down your blood pressure. So it's very much all tied together.
And I was reading something here, Doctor. I was wondering if I could share this with you. It says becoming more active can lower your systolic blood pressure. That's the top number when we take our blood pressure, so the top number. It can lower it by an average of 4 to 9 millimeters of mercury. Can you kind of dumb that down for me and just tell me how much of an influence that is?
Sure. I mean, first, I think it's important to define where we kind of draw the line as high blood pressure now, because we've been bringing down those numbers more and more. So at this point, any blood pressure, we're talking about systolic now, the top number, between 120 and 129, we actually now call pre-hypertension. Really? And so once you get beyond 130, we're now actually calling that hypertension, systolic hypertension. And so when you bring up a number like 4 to 9 millimeters of mercury, we're talking about bringing down that number potentially from a range of somebody who has 135 now down to pre or almost normal blood pressure.
Wow, and just with exercise.
Just with exercise.
Amazing.
And potentially weight loss with the exercise.
Fantastic.
And speaking of exercise, just the viewers, always consult your doctor before starting any kind of exercise regimen. Doctor, let's get back to Olga's blood pressure situation, her genetic. One of my brothers as well. He's on medication. Are you on medication?
I am.
Okay, is that?
Valsartan. I love saying it like that.
Say it again.
Valsartan. Valsartan.
Well, I've never heard it referred to that way before.
Are they going to be on that medication for the rest of their lives? How can they not be on medication for that? How can you stop that?
Well, it just depends on how severe this blood pressure issue that you have is. If you're in the kind of mild or borderline range, as we discussed, something as simple as exercise and weight loss can actually bring you down to a point where you may not need medications.
So, Doctor, when someone starts an exercise regimen, when do they start seeing, because it's not going to happen overnight, when they start that exercise and you're telling them you need to start, when can they start seeing maybe the possibility of the numbers going down? Does it take a month, 2 months, 6 months, a year?
Well, people can start to see benefits as early as 2 to 3 months with exercise, especially if they're consistent about it.
That's fantastic. So again, drug-free, why not try it? You got nothing to lose.
Look, as something as simple as just standing as opposed to sitting, they've shown in studies can actually bring about a benefit here. So it's never too late to start something like this, and no activity is too little.
Stand up right now.
Just simply standing can improve survival, and they've shown that many times in different studies.
Food intake, would you suggest any of that as well?
Well, food intake, diet recommendations are very controversial, obviously. It seems like you can read something in the paper one day and then a few days...
The next day it causes something else.
A few days later, it's the exact opposite. I think it's hard when you're studying these things to control for a lot of the biases, that other things people are eating, other things people are doing, smoking, not smoking, these kinds of things. But I think that the overarching theme is to not eat too much, maintain a good calorie goal for the day, and try to make smarter choices. Essentially, you don't necessarily have to be a vegetarian to get benefits or eat a Mediterranean diet. Any diet that's a fair number of calories, where you make some good food choices with the types of carbs that you take in and the types of fats, you can see a benefit from.
And speaking of choices, exercise, what do you do?
Like tennis.
Tennis, okay.
Elliptical machine and all that. But some of the viewers might be scratching their heads saying, well, exercise, just standing up is not going to be enough for me. Walking, tennis, running.
There's so much.
What do you do?
You don't have to go to the gym.
Right?
Anything that brings up your heart rate a little bit, brings up your breathing rate a little bit, and where even depending on if you're going to go for something that's moderate intensity, where you can actually still carry on a conversation, and so it's enjoyable. Do it with someone else.
So if let's say Ogle and I are jogging or walking fast, and we can't keep up a conversation, we're doing it too fast, we're not doing our body any good, or if we're having an easy conversation, we're not doing it any good either.
No, not at all, actually. So the recommendation that the AHA has put out is 150 to 300 minutes of moderate intensity exercise. They also say if you are somebody who prefers higher intensity exercise, like you're referring to, those numbers actually get cut in half. So 75 to 150 minutes of high intensity exercise, same benefit.
Obviously, because you're doing more aerobic. I also think mentally, I'm a runner, and I get the runner's high. I really do. I still do, even after 30 years, I think. Boy, I'm getting old.
What is a runner's high for people out there?
A runner's high it's almost like euphoria. Like you're running and you become euphoric and you're just somewhere beyond happy. You're just over the top. Yeah. I can actually mention something else that takes me there, but we're going to keep this PC today. So doctor, my point is mentally, I think you should have something that you love to do too, because then you're really going to get into it, right?
Something that challenges you and something that keeps you happy, exactly. Because you're more likely to stick to it in that manner.
Exactly. And let's not forget to consult your doctor before starting any kind of exercise.
Right.
I just want to repeat that because it's very important.
It is, and we only have about 45 seconds, doctor. Just give us just the ramifications of what would happen if we don't exercise, if we don't take care of our heart, if we don't pay attention to those risk factors. Yeah. What are we in for?
Well, you're more likely to run into heart disease a lot earlier in your lifetime and not be around long.
There you go.
And so it's
and
very
that
important.
That was a perfect soundbite to wrap up our segment.
Very good.
Thank you, doctor, for being on the Smart Life.
It's a pleasure. It's good to be here.
Thank you, doctor. More Smart Life after this.
Connie Beauvier enters the hospital with open arms to hug the medical staff that saved her. Last May, she walked into the emergency room and collapsed. The first thing she remembered?
My oldest son looking at me saying, "Mom, do you know where you are?"
Connie spent 22 days in the intensive care unit with pneumonia, sepsis, and blood clots in her lungs.
Her respiratory failure was so severe, in fact, that she needed to be paralyzed for a prolonged period of time and flipped onto her belly in the hospital bed in order to increase the amount of oxygen that we could deliver to her bloodstream.
Connie survived the deadly infection. She's used to beating the odds, breaking barriers in the 70s as one of the first female telephone splicers. This single mother of 5 hates feeling afraid and weak.
I can't even put like a water pitcher in my fridge.
Dr. Butcher says U.S. experts are just beginning to recognize the combination of physical, cognitive, and mental health issues like depression and anxiety that plague patients once they're discharged.
Cognitively, they may find that they have difficulty remembering things that they could easily remember in the past. They may have difficulty concentrating or paying attention to something.
Last year, Dr. Butcher developed a critical illness recovery center. ICU patients are evaluated shortly after discharge and then referred to specialized physical therapy, occupational therapy, or speech therapy. Critical support for patients on the very long road to recovery.
This is the journey to my best.
She's here to enjoy her family's big days. I'm Marty Salt reporting.
You have a question? We've got the answers. Stay tuned for our Ask the Experts segment.
You're watching The Smart Life on the Health Channel on South Florida PBS. If you'd like to learn more, please visit the Smart Life page on our website at allhealthtv.com. If you have a question for our experts, please visit the Ask the Experts page or give us a call at 855-796-4475.
Don't forget to download the Health Channel app. It's available free at the App Store or on Google Play. Follow us on social media at All Health TV on Facebook, Instagram, and Twitter.